an accountant, and then she decided to become more an exciting person, and moved into the charity sector where she was the CEO of a whole bunch of different charities doing things on HIV, drug use, disability, etc. And she then became a local councillor and ended up running a large London local authority. So she has a huge amount of experience in all kinds of different things to do with the provision of public services. Mark Porter is a consultant anaesthetist at the University Hospitals Coventry and Warwickshire, and he's here representing the British Medical Association. He's on the BMA Council and also on their Consultants and Specialists Committee, and there he's responsible for negotiations of pay, terms and conditions. Norman Lamb doesn't need any introduction to any of you. I watched him giving an extremely good masterclass in how to deal with Andrew Neil on the telly last night. He's got a very good reputation as a local campaigner. He managed to turn a 10,000 Tory majority into a 10,000 Lib Dem majority in very short order.
10,600.
10,600, sorry, I apologise. You were previously trade spokesman, I think, and you were involved in getting the Lib Dems to agree to part privatisation of the Royal Mail, so you've got a lot of background. And for various reasons in this question, why is profit a dirty word in public services? It's always struck me that our attitudes to the provision of public services by profit-making bodies are sort of radically incoherent. On the one hand, we allow profit-making companies to provide fostering services, but we certainly don't allow them to provide adoption services. We're very happy for publicly funded nursery provision to be made by profit-making providers, but when the kids that turn 1 year older, we certainly don't want the schools to be profit-making, or do we? Because of course we have one local education authority run by Circa, it's a private provider, and in every single area of the public services we find examples like this. So we're very happy about adults buying their social care from private providers and letting them choose, but then if you think about the same principles in healthcare, people feel very nervous. Lots of different reasons for that, some good, some bad, and some people have fears about safety, unions have fears about the wages, terms and conditions being driven down. People worry that private providers will behave in a short-termist way. You think about things like National Express and their rail channel franchise. People worry that the system might become incoherent, like one of the reasons that rail track was not a popular privatisation was the lack of accountability in the field, that the buck was being passed between different things. So lots and lots of different sorts of reasons why people are worried about profits in public services. And I thought we might start that by turning to Stephanie. We are going to have, let's start with, say, 5 minutes from each of our main people, and then we can throw it open to discussion, and I'm sure you will all get to ask a question if you want to. Are you happy to start?
I'm happy to start.
Very good.
Okay. Well, first of all, thank you very